And he's here to tell us more about alternative ways to deal with back pain. We welcome back Dr. Daniel Newman. Dr. Newman, lots of people deal with back pain, and there are different types. You say some can be acute, and also, what was the other one you were saying?
Chronic. Chronic is
gotcha.
when back pain is either long-term or you get progressive episodes of back pain.
And can you help any of this back pain without going to medicine?
Especially with chronic pain. That's when you can really do a lot of things to help with chronic back pain without necessarily having to resort to medications or surgery. A lot of chronic back pain comes from tight spots in the muscles, a condition called myofascial pain syndrome. And the way that can be dealt with most effectively, in my experience, is either a technique called Rolfing, which is a hands-on bodywork technique, but it's distinct from massage in the sense that you're not only releasing the muscles, but also the fascia, the connective tissue. Another technique is something called counter strain, which is a specialized way of gently releasing the muscles that some physical therapists are trained in.
And that's when you have when you've pulled a muscle, say. Right.
Well, pulled a muscle is somewhat of an indistinct term. What we're really talking about is what's called activation of trigger points, which are these chronically tight spots in the muscles that sometimes are quiescent. We don't even know they're there. But then you do the wrong thing, and it causes the whole muscle to go into spasm.
Just did that.
Well then,
yeah.
And if the gentler techniques like the counter strain and the Rolfing are not effective, then I found a technique that I've specialized in called trigger point injections to be very effective, where you take small amounts of Novocaine and inject them into the tight spots in the muscles, accompanied by a very specific stretching program. And I've done that for decades and found it to be very effective in many circumstances.
And then what about if it's a joint problem then?
Well, a lot of times if you have the joints in the spine, the facet joints are tight or locked, then manipulation, the kind of thing that a chiropractor, an osteopath, or a naturopathic physician can do, can be very helpful. You can also get problems with ligaments sometimes in the back, and if you have chronically strained or partially torn ligaments, then you can help those to repair with a specialized injection technique called prolotherapy.
Prolotherapy. Never heard of that.
Prolotherapy. It's actually been around for about 50 to 60 years, and it's getting more and more accepted these days. More and more physicians, even some orthopedists, are doing it. And it's an injection of classically a concentrated sugar solution that stimulates the ligaments to repair themselves.
Oh, interesting. Now, you also brought some herbs here, right?
Right. In other words, if you have back pain, particularly chronic back pain, and you don't necessarily want to take prescription medications or even over-the-counter anti-inflammatories all the time, there are a number of herbs that have anti-inflammatory effects. Things like bromelain, which is found in a product like Bromozyme 2400, organic hops acids. This is not necessarily just, drinking a beer and having hops that way, but a special extract from that, a product called Relief, also has anti-inflammatory effects. Or you can combine those together with things like turmeric, or an herb called Boswellia, willow bark extract in something called Pain Release. And those can be quite effective in taking down inflammation and helping with pain.
Are they as effective as, for ibuprofen?
It depends on the situation. It depends on the dosage. But in some circumstances, I have found them to be as effective as anti-inflammatory medications, and without the same risk for side effects.
And one of the things you mentioned is it's important, if you want to avoid back pain, to really get your core strength up, right?
Yeah. In other words, the old ounce of prevention worth a pound of cure.
Sure.
If you strengthen your core with either core training or some sort of a technique like Pilates, and you combine that with stretching of the musculature, which you can do by either learning different stretching techniques or doing yoga. And then one thing I found to be very effective in conjunction with that is teaching the brain how to coordinate the muscles more effectively in a technique called reciprocal inhibition optimization, or RIO.
Well, I wish we had more time. I want to tell folks, though, if you'd like to find out more, Rising Health Wellness Center, 360-696-3800. We'll put that information on our website for you, too. Thank you very much, Dr. Newman. Appreciate it. There's a lot more AM Northwest after the break. Stay right there.